thank you very much for this introduction. One of the reasons I accepted the invitation to have this presentation is very simple. Being active in health arena for a couple of years, in different countries, I have found the same situation over and over again. And one of the things I would like to present to you is some of the motivational factors for eHealth initiatives to be successful, and one of the reasons I think that those initiatives are going to be successful now. But let's start with some of the trends that we can find in the healthcare arena right now. I'm not going to go through all of the trends that you can see on the slide. I'm going to expose just three. First of it being the reason and the change in the healthcare system that is moving from a provider-focused system, which is trying to measure and assess the effectiveness of each individual provider, to a more patient-centric system. The second trend that is an important thing for the eHealth arena is that the healthcare system is changing from a system that manages individual episodes.
What kind of opportunity do you see for small and medium enterprises in Carinthia and Slovenia to find a field of specialization? Because I'm sure you already thought a lot about that in your company. I don't want to ask you to give us too many secrets that you have in your company, but just giving the audience a hint on what would be a possibility.
Yeah, excellent question. Actually, I have to take, I would say, two dimensions to that question. First of all, that healthcare sector is a bit special and it differs from all the other industry sectors because if you can see, there is 25 hospitals in Slovenia, 70 health homes, and more than 1,500 small private clinics, private organizations doing the healthcare services, meaning that there are SMEs. And there are big organizations that have trouble understanding how the SMEs do work and provide the services. So this is one of the things, is to focus on a target segment which is very appropriate or in the same area as we are, and we can understand them a bit better than the bigger companies. And to the other hand, and that's why I reverse to this slide, is that in all the potential applications that by itself are going to pose some questions or some additional ideas on it, you have to select a couple of services that you want to be excellent in. And what my company has decided, and I think that this is quite public, is to go from the partners that we already have today and try to impose the eHealth initiatives to those partners. And we cannot do that all by myself. That's why we are trying to find the partners to do that, to form an ecosystem of SMEs, because there are 40 of us also, so not a big company, to build an ecosystem of partners where each can provide individual part of the services. And there is another thing that is very important, and I think this is the most important thing, is that we all are basing our solutions, our products on the same set of standards that do exist in the world. Those standards actually do enable interoperability and collaboration between the different products. So I would guess this would be the third answer to your question. Well, trying to see that the workforce and the people in Europe are more and more mobile, getting from one location to the other, meaning that it is stressing the healthcare system in the location where you're moving to. And technology, especially using the ICT technology to enable or to lower the problems that the people have when moving to a new location, can help a lot. One of the things eHealth can do and will do in the future for all those people moving around is to provide the data that's going to go behind them and enable them full medical services based on the data that's already gathered. Result of that is that the quality of the health services should be better, and the probability that there will be mistreatment of those patients is going to be much lower. I think that this is one of the good issues, good results of eHealth in comparison to mobile workforce.
Okay. Is this enough for you? Yeah. Also enough for you?
Yeah, the short answer, yes. There are a lot of regulations, directives, guidelines, rules that are set in order to enable the one side the moving of the people, and the other side to present the healthcare system with the change environment. That is, that we're going to get in the multi-language environment where there could be some language barriers in getting and using those healthcare services. On the other hand, I can say that the data issues that occur when moving from one location to another are well covered. In European Union level, there are multiple directives defining the rules and guidelines how the data should be protected, how the confidentiality of the data is assured, and how there are possible rules who can access the data once I am in a separate location. So that consent management as a principle is well in place in Europe, and it is then propagated down to a national, regional basis. I think the answer is yes. Yes. You have to know that you have the different levels of digital access to a digital level with different customers, different clients. And what you have to be aware of that there will always be some groups of clients, patients that will not have a full access to the technology. Therefore, not being able to use the services that you're going to be just eHealth related. But on the other side, I think that involving patient in the health process itself is one of the major goals of the eHealth, because you have some 500,000 professional medical staff in Europe, and on the other hand you have 500 million patients that can add some value to the healthcare process. So I would guess that providing the information on healthcare services to the patient, providing the data to educate the patient how to live more healthy and how to take care of his health is an extreme value for both the patient and to the other side, to the healthcare system, which is going to be less impacted on the demand that comes from the patient. No, I would say definitely no. We have to put certain rules and guidelines in place. But once we do that, then we have solved the problem, and we shouldn't be thinking about that. My guess would be that in the near future, because of all the guidelines that exist, so directly from the EU level and all the national legislation and regulation that exists, that's going to be a problem of the past.